Why are fasting instructions critical before diverticulitis diagnostic tests? Imagine trying to get a clear picture of what's happening inside your abdomen. That's exactly what doctors aim for when they perform diagnostic tests for diverticulitis. To do this accurately, fasting before certain tests is essential. Diverticulitis involves small pouches in the colon called diverticula that become inflamed or infected. Correct diagnosis is vital because symptoms like abdominal pain, fever, and changes in bowel habits can resemble other conditions. A precise diagnosis helps determine the right treatment and prevents complications. The most common test used to diagnose diverticulitis is a computed tomography scan of the abdomen and pelvis. This scan creates detailed images that can reveal inflamed diverticula, abscesses, or other issues. To get the clearest images, patients are usually asked to fast beforehand. Fasting means no food or drink for a specific period, often several hours before the scan. This is especially important if the scan involves oral contrast, a special liquid you drink to help highlight the intestines. When the stomach and intestines are empty, the images are sharper, making it easier for doctors to see the problem areas clearly. Fasting also reduces the risk of vomiting or aspiration during the procedure. Aspiration happens when stomach contents accidentally enter the lungs, which can be dangerous, especially if sedation is used. If you eat or drink before the scan, food can obscure the images, making it harder to identify issues. This could lead to missed or incorrect diagnoses, delaying proper treatment. For example, food in the stomach can block the view of the intestines, and in some cases, eating before sedation increases the chance of complications. While fasting is crucial for imaging tests like CT scans, other diagnostic steps such as blood, urine, or stool tests usually don't require fasting. However, if a colonoscopy is planned later, often after the acute phase of diverticulitis, fasting is necessary to ensure the colon is clean and clear for the best view. This involves avoiding food and drink for several hours, sometimes up to 24 hours, and following specific bowel preparation instructions. It's important to follow your healthcare provider's fasting instructions carefully. Not doing so can compromise the quality of the images and the safety of the procedure. For instance, eating before a scan with contrast can lead to blurry images, and eating before sedation increases the risk of choking or aspiration. Always ask your doctor if you're unsure about how long to fast or what you can drink. Remember, these guidelines are based on established medical protocols designed to protect you and ensure the most accurate diagnosis possible. In summary, fasting before certain diagnostic tests for diverticulitis, especially CT scans with contrast, is essential for obtaining clear images and reducing risks. It helps your healthcare team see exactly what's happening inside your abdomen, leading to better treatment decisions. Always follow the specific instructions your medical team provides, and don't hesitate to ask questions if anything is unclear. Proper preparation is a key step toward effective diagnosis and recovery.